I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Our mission is to promote policies and programs that enable seniors to live with independence and dignity in their communities. Promoting dignity and quality of life can take many forms. On our Aging Insights programs, we have covered a variety of topics, including health issues, economic, food security, creativity, and fitness. Today, we're going to explore the alphabet soup of aging and caregiver services. Our guests today include Kathleen Otte, Bi-Regional Administrator for the Administration for Community Living, and Nancy Day, Director of the New Jersey State Unit on Aging. Seniors often want to stay in their communities, and there are many services that can assist them that are supported both by federal and state benefit programs. A combination of these services can enhance the quality of their lives and would improve their economic security as well. Today, we're going to look at many of these programs that are available to seniors and caregivers. So let's start with discussing the national initiatives that address senior needs, and we can begin to explain the long list of alphabet soup services. Kathleen, I appreciate you being here. So why don't you begin to explain to us, even your agency even has a new name.
Yes, we do.
And so, but there's a long history, so.
There is, and the Administration for Community Living is a new administration, but it actually encompasses both disabilities and intellectual disabilities and developmental disabilities, and serves those people over the age of 60. Many people are familiar with the Administration on Aging, and indeed we merged disabilities and aging to create this new administration to encourage people to remain at home in the community. But the Administration on Aging is the core program of what we deliver to our seniors in the state of New Jersey. And those programs are considered really some of the foundation of services that we know and encourage people to remain in the community, such as our nutrition programming.
And how far back does this go? I mean, the Administration on Aging is how old?
Well, we're celebrating our 50th year this year. 1960.
Not a senior yet, Wendy.
No, not yet. No, that will be 10 more years. But in 1965, it was part of the Great Society legislation. And truly, it was meant to create an opportunity for seniors to be served in places in the rural communities, people who were non-English speaking, and people who had specific need. And we really haven't deviated from that mission today. We still serve that underserved population in all of our states.
And the Older Americans Act, is that the core funding for your program?
Yes, it is. The Older Americans Act, 1965, was the actual year that was promulgated, but it serves to serve our core programs such as nutrition counseling, senior centers, our caregiving program, adult abuse and exploitation programming. Those we consider to be our core programs. And in addition to that, we have a broader spectrum of services to promote wellness and healthy aging.
I know we probably didn't talk about this, but obviously there are other funds that you sort of pull into your core services.
We do.
So
the core services, as I make mention, are those items and services that we've just talked about. But we do want to recognize that the senior of today is not the senior of yesterday, and so we really want to provide educational services so that people can learn about their disease progression and also be able to really live a healthier lifestyle, knowing that with healthier lifestyle they will reduce the cost involved and also the quality in their years, so to say.
I guess what I was also referencing is the fact that there are older worker programs. These are things we didn't talk about. Older worker programs that come from another part of government. There are some nutrition supports that come from some other departments. But the reality of it is they all kind of weave together through the structure that you've created. Since you mentioned that service needs change,
Yes.
How do you become flexible and deal with new priorities and perhaps the funds that need to address
Well,
them
the
as
funding
well?
has been most challenging, but as you make mention, some of the services have remained constant since 1965. And with good partners, such as our state officials in New Jersey, we work together to identify how we can best meet those needs. The core programs will remain constant, but we bring into other arenas other things that we can do, such as the Aging and Disability Resource Centers and the connections in New Jersey to help people learn in services that are available in their communities. Another program that we bring in are some of the chronic disease self-management programs as a real opportunity for people to be educated about services. But we also recognize that people need mental health services, that people need help and assistance with some of their Medicaid questions. So we do try to come together utilizing our federal partners along with state partners to meet those needs.
Right. I know you mentioned a variety of categories.
Yes.
You mentioned elder justice or elder abuse.
Yes.
And I know that's maybe Title VII
Title
of the
VII, yes.
Older Americans Act. And then there's also some legal services. I mean, it's sort of an interesting umbrella that has been the core services over the years.
Has been, and I think the beauty of the Older Americans Act as it was created is to allow states to have the flexibility to utilize those fundings as they see most necessary in their state. But again, our largest item is our nutrition program, but Title VII, which is of course our elder justice and also legal services piece, is gaining in strength and understanding because people really want to take control of their own destiny as they age in this particular period of their life.
When you talk about nutrition programs, are you speaking about the congregate meal sites?
I am. The congregate meal site, in addition to what we refer to as home-delivered meals or meals on wheels, but the ability for seniors to have a nutritious meal at least one time per day, and encouraging socialization in our congregate center. We recognize how important that is, not only to have a nutritious meal, but also to have that fellowship, to have that socialization that's vital to living a healthier lifestyle.
Yeah, and I also think that there are changes that occur, and I know that the year of 2015, we're talking about the White House Conference on Aging.
Yes, we are. The White House Conference on Aging is a great opportunity to hear the voice of the people. And we will have our White House Conference on Aging in Boston, which actually covers 3 of our HHS, our Health and Human Services regions. But it'll talk about various areas. Adult abuse, neglect, and exploitation is one of those areas. Also financial planning, make sure people plan for their retirement. Additionally, making sure people live a healthier lifestyle. So those are some of the initiatives that the White House Conference on Aging will be listening to hear the concerns, the issues, and sometimes the strengths of our programming, what's working, what we can do better to meet their needs.
I think it's a nice opportunity for people to get engaged.
Indeed.
And we have a lot of seniors in New Jersey, and we really want to hear from them, so I think it's important that
Absolutely.
you've mentioned that. And I know there are some other programs across the country, and so I think you're really going to get a variety of perspectives, I'm sure.
Absolutely.
And so when I think about the Administration on Aging and I think about the Administration on Community Living, I know, as you have already referenced, that really one of your key partners are the State Unit on Aging.
Absolutely.
So that's why I'm happy Nancy is here too, as well, to sort of discuss services. And so if we were really going to draw a big picture, we have the Department of Health and Human Services, then we have the Administration for Community Living, and then you work with the State Unit on Aging in all the states.
Yes, we do.
And territories?
Yes, territories as well as our Native American partners.
That's right, tribal.
We have our tribal partners as well. And again, it does flow, the funding does flow from federal to state and then to the providers on their individual programs. Each state is a little bit different.
Right, in New Jersey we have 21 county
That's
offices
right.
on aging, and I know, Nancy, you work with all of them.
Yes, we do. It's our pleasure to have our partners at the county level. And New Jersey has one of the longest histories in serving older adults. We actually had the first area agency on aging before the Older Americans Act in Bergen, and the State Unit on Aging was actually established in 1957. So it's been a mission of New Jersey to serve older adults.
I think it's as you said, it's a long-serving tradition, and I think that's very important. And I think things have changed in terms of who you're serving now. So what in terms of the core services that Kathleen was mentioning, what do you see as the core services that have remained steady over those years?
I think probably the services that are most important to older adults are the nutrition programs, both in terms, as Kathleen mentioned, the congregate program, being able to go at lunchtime, join friends, have a lunch, make sure that you're eating healthy, and connection programs and services are offered through those senior centers. Home delivered meals has also been a vital program, and what we've seen in changing years ago when I started in the Aging Network, the congregate were where the most numbers were being served. And in fact, the funding stream really supports congregate. But today, as people are living longer and remaining in the community, we've seen an entirely different switch from people going to the congregate. Now people are really needing meals on wheels or home-delivered meals. So that is where most of our effort has been. Aging, healthy aging is really a core mission as well, because we want people to remain in the community and they need to be healthy to do that. There are legal services, supports that are given. Transportation is another program that we see as a very important, being in your community. Some people can no longer drive, so through their county offices on aging, they may be able to arrange appointments to their doctors, grocery shopping, again, keeping them active and supported in the community.
One of the core services that I think about is INA, so it's part of that alphabet. And so I say that because if somebody's going to pick up the phone in their home, whether they're calling for a loved one or whether they're calling for themselves, it's that INA that I think is so important. So why don't you just define what INA is?
Information and assistance is absolutely the core of what we do. And it's always, when we do any kind of presentation or surveys, the thing that people want most, whether it's the individual, the caregivers, neighbors, friends, is accurate information, timely, accurate, that they know how to navigate then where to go for these services. It's very confusing, the Aging Network. And there are many partners in New Jersey. We fund over 400 community agencies. So how do you know where to go?
Right, so let me just stop you there. So you have 21 county offices on aging that, if I remember correctly, have the responsibility for planning and contracting for services. And some of them do some services together. So what you're saying is those 21 counties then contract with their local providers, and that's the provider network that you're referencing?
Absolutely. They may be home care agencies, they may be legal services providers, they may be a senior center, a wellness program, and it's really important that they, again, contact their local county office on aging that can help them and guide them and connect them. I think that's important.
Now, we do have a little alphabet soup about county offices on aging. So we have area agencies on aging, also known as the AAA, not the car AAA. I mean, you know, because it does get confusing. And then Kathleen referenced ADRCs. And so, Nancy, can you describe the relationship between a AAA and an ADRC?
In New Jersey, they are really one and the same.
That's why we like this.
And so under the national initiative, again, New Jersey was very fortunate to be one of the first 12 states that was funded to create an Aging Disability Resource Center. In New Jersey, we chose to just change the last word to connection. And it is now statewide. And it's really focusing on core services, information and assistance, getting people through the system, looking for home and community-based supportive care. Because that's, again, another area that people are needing supportive services, home care, access to long-term services and supports, meals. And we have a screening process that people can pick up the phone. We'll go through a series of questions and be able to tell them the type of home care program that may be best for them, whether it's their income resources that might qualify for them for managed long-term care services, or whether it's through the Older Americans Act or state-funded programs. We'll be able to direct them and link them where they need to begin the eligibility process.
And I think that's important. As much as we all say we, I know that oftentimes it's knowing who to call in your county. And so I say that because the State Unit on Aging works with all of the counties, but if I lived in Mercer, or I live in Somerset, or I live in Bergen, you know, I want to talk to that local person, and you're right, they're going to know who the service providers are. And maybe someone's only calling for a ride, but by the time they finish with the screening tool, they're going to know that now not only are they going to hopefully get that ride, hopefully, transportation is just such a high priority. It's just an incredible need. But hopefully they'll also be eligible for some other services. The foundation has done a lot of work on elder economic security and really looked at the cost of living for seniors across the state. And most of the work focuses on single and elder couple households. And so we looked at, and it's surprising, 30% of all New Jersey seniors rely solely on Social Security, which is not really what was ever meant to be. So we know that the average Social Security for a woman in New Jersey is about $15,191. And so this person would be eligible for a variety of services that we know could improve the quality of life. And I'm using the ideal average elder woman. And so we know that a one-bedroom apartment across New Jersey for this person would be around just under $30,000. So there's a variety of programs, and that's why I thought it was so important today to talk about federal and state programs that could really make this person a little more economically secure and improve their quality of life. So there are some services that we frequently talk about, and New Jersey's been very fortunate to have a pharmaceutical assistance program known as PAAD, which I understand was started in 1975. Mm-hmm. So, so Nancy, why don't you describe a little bit of it, and I'll make a list and we'll go through the list a little bit. But PAAD?
PAAD, some people refer to it as PAD.
That's right.
It is a program that provides assistance for pharmaceutical drugs. Mm-hmm. People, again, can apply. There are some income limitations. For a single person, it's $26,575.
So the woman at $15,000 would be very eligible for
Absolutely.
This program. And a man, his average Social Security in New Jersey is about $19,000. So right away, these two people would be eligible.
And that's probably one of the most important messages to take away, is there are a number of programs, there are a number of combination of what income, resources. Now in the PAAD program, resources are not counted towards eligibility.
So a resource is a car?
No, it would be
House?
income.
Income, oh, I'm sorry, okay.
So again, it's important. It's hard to remember all of the eligibility guidelines. And going back to your Office on Aging is the place to start, because they can ask you those questions. How much income are you getting a month or a year? What are your resources? And once again, there are federal programs that may also provide additional supplement for you, whether you're paying for your Medicare Part B or for Part D. Again, all of the alphabet soup that you mentioned. It's how do you remember that?
Right.
You don't need to remember it.
Right.
You need to call up your county Office on Aging and say, I'm looking for assistance to pay for my medication. I'm looking for assistance to pay for utilities. I'm looking for assistance to pay for my groceries. So,
when I think about, there's also another pharmaceutical program that I haven't heard a lot about, but I know it's out there, and that's Senior Gold, and that's even a higher level, right?
Yes, for individuals that are between the PAAD, the $26,000, a single person, up to $36,575 is eligible for, again, assistance towards the cost of their medication.
And I think it's interesting. I know Kathleen's here, and I do want to emphasize the combination of federal and state programs, and SNAP. We often talk about SNAP, and which stands for Supplemental Nutrition Assistance Program.
That's right.
Also formerly known as food stamps.
That's right.
And I have a feeling that that sort of scares people a little bit, but the supplement through SNAP can do so much to improve the quality of life, to healthy aging. So
absolutely. And the County on Aging people that are there to serve our citizens of New Jersey are trained to be very sensitive, and certainly they really are very welcoming. So I would encourage anyone that has a question or is interested in some of the services that we've spoken about today to call those offices so that they can learn a little bit more.
Sure.
But again, I think it's one of those things with the nutrition program. We want to keep people healthy, and we want to keep them in their home. And I think the SNAP program is an excellent way to keep people to do those two things.
Well, you know, it's funny, because of our research, we have estimated that if somebody participates in SNAP and somebody participates, if they're homebound, then they get Meals on Wheels, or if they can go to a congregate nutrition site. There's also the Farmers Market Coupon program, which comes out of U.S. Department of Agriculture,
That's right.
which is a federal program as well. And we estimated that they would have an additional $1,200 a year. And when you want to pay for your utilities and your rent, I mean, this could really be an important resource for a senior.
And fresh vegetables as well, which is always just the
Exactly.
bonus.
Exactly. And so I think that, it's, again, that merging. And Nancy, you mentioned utility programs as well. So I think some of those are federally funded and supported through New Jersey screening.
As well as some state programs as well. I think it's important to understand in New Jersey we're trying to make that application process streamlined, and we have a universal application, so if someone's applying for PAAD or Senior Gold, then we're also going to help sort out whether they'd be eligible for some of the federal programs. Again, names that people will not remember, whether it's...
Wait a minute, SLIMBY,
and
QUIMBY, these are
Quimby.
subsidy programs that can help, as you said, with your Medicare premium, so yeah.
So all you have to do is call for an application and we'll help you with the other types of programs that maybe you'll qualify for.
Right, and I know you mentioned managed long-term care services, and under that heading, there are a lot of services when I think about it, and some of it is Medicaid funded, and then there's Jack, and you want to sort of go
Sure,
through a
again,
couple of others?
we're famous for lots of different alphabet soup programs.
Sorry.
So in New Jersey, MLTSS, people may be hearing that. That's a Medicaid program for individuals that have physical functional limitations. There's, again, a clinical eligibility as well as financial, but they may be able to get assistance with home care, or some people are choosing to live in assisted living. We have a state-funded program, very similar, same type of clinical eligibility, but a higher income. And it will provide services in the home for individuals. Home care, adult day care can also be funded. We have another program that is for caregivers, several programs for caregivers, and I think that's really important for people to understand, that we have to take care of caregivers because they're under tremendous physical, emotional, and financial stress. And there are programs, whether it's through the Older Americans Act, a state-funded program called Statewide Respite Care Program, or Alzheimer's Adult Day Health Services Program. These are programs that are there to help them take care of whether it's a parent, a spouse, a child.
So what type of services would someone get from respite services, so our viewers have a better understanding? Someone to come into the home?
Yes, you can have somebody come in the home and you can leave to either do grocery shopping, even vacation. A lot of people can't go to weddings or college graduations because of the person not being able to travel. So we may be able to find, even in a facility, an assisted living room for someone to stay while you go away, or someone to come into the home. So we try to provide those services for, again, the person who's caring to take a break.
One of the new needs I could think that's come up, and maybe you've dealt with it both at the federal level as well as the state, are grandparents caring for grandchildren.
Yes. Title III-E under the Older Americans Act actually addresses that need, because we've seen the prevalence of that occur much more frequently over the course of the last 20 years. But we have many grandparents who are providing care for grandchildren, and there's actually some programming available for the grandchildren, such as summer camps and so forth, so that they can get away and have a great educational program and give a little bit of respite to the grandparents. So we know that those programs really work and support people who are providing care to people in the home, and if we can encourage that and extend that, again, just kind of reiterating the same thing in the same message, but people will live a healthier lifestyle.
Certainly.
And the caregivers will be able to provide care perhaps a little longer.
Yeah, and since you mentioned health and wellness, I know New Jersey's had a strong program with Healthy Bones and Move Today. Is that the right title?
Yes, Grace, it is. We've been very active.
Wait a minute, let's all move. No, sorry.
And chronic disease self-management is
that's right,
another
that's right.
program. Learning to manage whether it's arthritis or diabetes, there's ways in which you can take control. That's probably the best message is taking control, both whether it's your physical well-being, your financial well-being. There are ways that we can help you. And just going back to the premise of the Older Americans Act is that The only requirement for Older Americans Act is that you're age 60.
Correct.
There are no financial
It's not
eligibility.
means tested.
It's not
So,
means tested, but some of the other programs you mentioned are. And
Yes.
so I think that's why it's important, and I think you both have said this, to contact the county offices on aging.
That's right.
Because they will ask some income questions, but it's only to see if you're eligible for the broad array as
Absolutely.
opposed to some of the core services. So is that a fair statement?
Absolutely.
Okay.
And I think that's one of the messages that we want, again, to stress today is pick up the phone, call your county office on aging, and they'll be able to identify programs and providers and help direct you and support you in whatever you're looking for.
So again, it's wonderful to have you both here, and I'm thinking that really goes hand in hand in terms of the federal dollars that have supported programs, but also, as Kathleen has said, allowing some flexibility as to how those are used. We didn't even get into taxonomy, but there's a variety of things that New Jersey has nuanced using federal dollars, and then has also added to the picture, to the menu of services. So I think that's incredible. I really appreciate you both saying it. And I think you've said it enough that people need to contact their county offices on aging, and we will give them that number. So thank you very much.
Thank you very much.
It's
Thank you.
very wonderful that you've been here and sharing your time with us today. So I want to say that Aging Insights is sponsored by the New Jersey Foundation for Aging, and hopefully it's to connect our viewers to the county offices on aging services, to give us feedback on this show, and to make donations to the foundation for future programs. Please go to our website at www.njfoundationforaging.org, or you can call our office at 609-421-0206. And we want to remind you to find out about senior services, as we talked about today, to please contact your county offices on aging. Each county in New Jersey, there are 21, they all have one, and you will see a listing of their numbers on our website, or you can call the state hotline number, which will connect you directly to your county office on aging. And that number is 1-877-222-3737. Thank you for watching this episode of Aging Insights. And remember, aging is everyone's business.